Hi, I'm Stephanie. I'm going to be the student physical therapist. This is Stacy. She's going to be our patient. She has a tibialis posterior tendonitis, so we're going to do an ultrasound on her. The first thing we're going to do is clean the ultrasound head. And then we're going to get the gel and put it directly on the ultrasound head. Then we're going to set up our parameters. So the ultrasound. All right, and before starting, we're going to make sure that it's making contact with the gel and her skin and moving. So I set the parameters at 3.3 because it's a pretty superficial area that we're working with and treating. Also, I'm doing 5 minutes because we're working in a small area with 2 ERAs, so I chose to do the 5 minutes instead. And then we started with a 0.6 intensity because I don't know how sensitive Stacy is to the ultrasound, and if anything, if she wants it warmer, she can just let me know and I'll put up the intensity. Making sure I'm at a 90-degree angle when I have the ultrasound head on her skin, moving in circles. You want to make sure that you're not moving too slow so that it doesn't heat up the area too much and get uncomfortable for the patient. And after a little bit, you can ask the patient, are you comfortable?
Yes.
Okay, she's comfortable. Do you feel the thermal effects?
Mm-hmm.
Okay. Again, if they don't feel it, then you can just increase it a little bit. Whenever the gel moves away from the area that you're working with, you can do a quick scoop without lifting the ultrasound head off the skin. Some contraindications for using an ultrasound. So if the patient's pregnant, you don't want to be using it anywhere around the abdomen. TB is a contraindication. They need to be able to have sensation in the area. Blood flow, circulation issues are a contraindication. You want to make sure that there's no bone growth in the area you're working in. That's pretty much it. And then, so I'll look at my patient every now and then, making sure she's not making any uncomfortable faces. And yeah, 3 minutes. After she's done with her ultrasound, I'm gonna wanna work out her tibialis posterior with therapeutic interventions just to work the area that we're working with and heating up. And again, I'm making sure that at no point the ultrasound head is coming off the skin because that could damage the crystal inside. So whenever there's awkward silence, you can ask the patient how they're doing today. Stacey, how are you doing?
I'm great. I could use a nap though.
Yeah.
But can't we all?
Yes. I could also move in a side to side direction with the ultrasound head, but I prefer to use the circles. 2 minutes. You also want to make sure that your patient's laying if they're laying down or sitting, they're in a position where they can be comfortable for at least 5 minutes or however long you plan on using the ultrasound. And you want to make sure that you're also in a position that doesn't ruin your body mechanics and that you're comfortable as well. It's also useful to keep the ultrasound machine on the side where your free hand is in case that you do have to make any modifications to the parameters that you're on. I like your earrings.
Thank you.
You're welcome.
Feel like jazzing it up today.
Okay, just a minute left. You can also add gel if you ever have any moving too far away. Another thing I want to mention is that I have the duty cycle at 100% or continuous, and that's because we want to have a thermal effect on the area. Yeah, almost done. Okay, now that the machine is turned off, I can take off the ultrasound head without damaging it. I'm going to use an alcohol wipe again to clean it up. Put the cap back on, and then help the patient get their gel off. Normally we use towels, but we have seemed to run out. Good, thank you.